All right, guys, welcome back to my channel, or welcome if you are new. This is my video series on my double jaw surgery that I had almost 2 years ago now. It was a double jaw surgery for a class 2 overbite with a reverse genioplasty. And this video is a little overdue because my last video I made about 4 months ago, back in July. It's now November. It was about my upcoming visit with Dr. Miloro, who is a jaw surgeon at the University of Illinois at Chicago, College of Dentistry. And he was recommended by my doctor to address my nerve issues. So if you haven't been watching my videos, I have extensive nerve damage due to my double jaw surgery. I still have some feeling and mobility in my muscles, but it's basically this whole area down here, my lower lip, my chin, even kind of out in this area. I'm pretty numb, and it affects my life somewhat. You know, I can't always pronunciate words perfectly or make certain expressions. Sometimes it's difficult to chew. So it does impact my life. And so I did ask that my surgeon who did the jaw surgery on me, I asked for his advice on anything I could do about that. And he referred me to this doctor in Chicago. And he is apparently one of the top doctors that specializes in this type of surgery for related to jaw surgery nerve damage. He is a professor and a researcher at the University of Illinois at Chicago. So I trust my doctor that this doctor he referred me to is very well known in his field. So I had that doctor's appointment back in August, and basically I'll cut to the chase here. He walked in and said, "I can't do business with you." So before he came in, obviously he had the hierarchy of doctors below him come in one after the other and look at me and do various sensory tests on my, jaw area, my chin and stuff like that. And basically the reason why he said he couldn't do business with me was because I already have more, sensory and mobility than he could ever give me with the surgery. So basically, if he were to do this surgery on me, I would actually lose some feeling and ability to move my mouth. So the surgery would not be beneficial to me. I think these types of surgeries are really just for people who have completely lost all feeling. The nerve has been completely destroyed. You have no feeling, or no mobility. It's kind of a last resort. And I really just wanted to make sure that I had exhausted all my options. And so I guess in him telling me that there was nothing more they could do, it kind of gave me some peace in my situation. Like I could finally grieve this and put it to bed and say, okay, this is all I can do. This is this is what it is. And like I've said before, this isn't the end of the world. Is it unpleasant, inconvenient? Sure, but it could have been a lot worse. And in fact, this doctor said he was really impressed with my results, which surprised me. He said basically for the type of jaw surgery that I had, right? I had a double jaw surgery where my jaw was moved forward. So pulling on those nerves. And I had a genioplasty on top of that where they cut the bone on your chin and move my chin back. So just with that and my age, so I was almost 36 years old when I got my jaw surgery. So I wasn't, in my teenage years or early 20s where you kind of bounce back quicker. He said this result was actually far exceeded what he would ever expect from this type of surgery. And that did kind of make me think that my doctor kind of undersold a little bit how likely this outcome was. And he did say it was an option. Like he did say it was, I can't remember. I have it in a video that I made. I can't remember if he said it was 10% or 20%. It might have been 20%. But by the way this doctor talked, he made it sound like it's more the rule than the exception to have, I mean, like he said, this is good. So worse even nerve damage from that type of surgery. And it kind of makes sense. Again, like I'm not a doctor and haven't researched this, but just from my experience and the things that this doctor has said, my guess or my expectation I would put to you if you're about to ready to have jaw surgery is if you are having a double jaw surgery where they are moving your lower jaw forward, I would totally expect that you will have numbness for the rest of your life. Some degree of numbness. I think, you have to think, especially if you're moving the jaw forward quite a bit, your lower jaw, you're going to be pulling on that. There's always going to be some stress on that nerve, right? Unless you're super young, maybe that nerve, is not done growing. Maybe that might be an exception. I don't know. Again, not a doctor or a researcher in this field, but that's just to give you guys kind of an expectation. I'm thinking, and again, I haven't had this surgery, but if they're moving your jaw back, like if you have a protruding lower jaw, maybe it's less. That's kind of my guess, but I don't know. But just based on the way this doctor was talking and saying that he was like impressed by my results, made me think that, maybe the type of surgery that I have, especially compounded with the fact that I got a genioplasty, a sliding reverse genioplasty, probably exacerbated my nerve damage probability. So that's just me spitballing here again. Not a researcher, not a doctor. But that would be the expectation I'd give to you guys, just as a forewarning. Now, someone on my last video asked about a laser treatment for nerve regeneration, and I did ask this doctor about that. And basically, what he said to me is that's like a newer treatment for repairing nerves, and they don't have a ton of research on it that proves that it has results. And he said, they don't do that kind of thing there, but if I want to go out and, pursue getting that kind of treatment, I certainly can. But he just said, he kind of warned me, we don't have a lot of evidence, research, studies, stuff like that proves that is an effective treatment. And for me, to each their own. Everyone's a Google doctor, right? But to me, I'm just like, I'd rather not pour any time, resources into, I could spend a fortune on that treatment and have no results. And I'm kind of already at a place where I'm kind of finding peace with what, the numbness level that I have. And I'm not really as hungry to fix it as I was before. I think I've kind of just made peace with it and moving on in life, and it's totally fine. I'm not suffering by any means. The doctor did say though, as far as like other ways to help your nerves kind of heal more, is you can take vitamin B12, which I already take. I've taken that every single day as a multivitamin for years, even before my surgery. And maybe that's what helped me recover better. But he said to take B12, or there is a over-the-counter, I think you can get Walgreens or something. There's like a nerve drug you can called Nervive. It's Nervive, Nervive. And I think it's a cream or a pill or something like that. I think it comes in different forms, but he did say I could take that, and I haven't done that yet because, again, like I said, I'm kind of at peace with it. Like, I'm still taking my B12 every day, and I think that will be fine. I'll be okay if that's all it is. Now, one thing I did ask him, because I was a little concerned, like, as I get older in life, like when I'm 70, is my jaw gonna be drooping down? Am I gonna be slurring my speech? Is it gonna get worse? Is this nerve damage going to get worse as I get older in life? And basically he said no. He said, no, it won't get worse. If anything, it might get better. That's not a guarantee, but he did reassure me that it's not going to slide back. I'm not going to go back to losing more feeling. Like once your nerve is repaired, it's repaired, but it might repair itself more, but it might not. But it's not going to go back. So I don't know if that gives any of you comfort if you're experiencing nerve loss as well, but it did kind of give me some comfort to know that, hey, at least this isn't going to get worse. So there's that. But overall, again, as I said, in my last video, I don't regret my surgery, especially now that I've kind of come to peace with my numbness in my jaw. I think it was the right decision for me. I feel a lot better about my jaw, how it looks, how I breathe. I can kind of perform at a higher level. I can do more cardio without hyperventilating and feeling like I can't breathe. So it's benefited me a lot. I think in the long term, it was the right decision for me. So I don't have any regrets, and I'm happy with it. So yeah, that's my story, guys. I don't think I really have any more jaw surgery videos I'm gonna film for my channel. I think this is kind of it. But I really enjoyed doing these videos, and I kind of didn't expect them to do as well as they did. Not that I did that exceedingly well, but I think I got a little over 2,000 views on one video, my last video, which was more than I ever thought. So thank you guys for watching my videos and liking my videos and subscribing to all who did. It was really just a project for myself to watch my journey, look back and see what I went through, and for my friends and family to see what I went through. So it was just interesting and fun for me to do. So thank you for tuning in. I might make videos in the future about other things. We'll see if I ever have time in my life, right? So thank you everyone for coming to my channel, and take care.